All right. I see a few folks are still hopping on, but we'll go ahead and get started. Again, good evening and welcome to our virtual panel discussion on young adults and mental health access, convened today by Young Invincibles and the Center for Developing Adolescent. I'm Erin Hemlin. I'm the Health Policy and Advocacy Director at YI. For those of you who may be new to us, YI is a national nonprofit organization where our mission is to amplify the voices of young adults in the political process and expand opportunity for all young people. We are very much looking forward to a great discussion today and have an excellent panel with us I'm very excited to hear from. A few quick reminders before we get started. Today's conversation will be in listen-only mode, but please do use the Q&A button to submit questions and comments throughout the discussion, and we'll make sure to save time at the end of today's discussion to address those audience questions. I'm very excited that we are joined today by Isabella Fernandes de Oliveira, a member of Young Invincible's own Young Advocate program in Colorado. Isabella recently graduated from Denver North High School in May of 2020 and plans to attend the School of Mines in the fall. In addition to being a YI Young Advocate, Isabella has taken classes at the Community College of Denver during her gap year. We are also joined by Cameron Vigil, YI's Rocky Mountain Engagement Manager. Cameron leads our consumer education and engagement work in Colorado and spearheads our Young Advocates program and Youth Advisory Board. And then rounding out our panel, we are delighted to be joined by Stacey Sterling of Kaiser Permanente's Division of Research. Stacey serves on the Drug and Alcohol Research Team and the Behavioral Health Research Initiative. Dr. Sterling's focus has been on health policies and interventions to decrease adolescent behavioral health risks, including substance abuse, depression, anxiety, and risky sexual behavior, and improving physical and mental health outcomes. Young Invincibles has partnered with the Center for the Developing Adolescent for this panel, of which Dr. Sterling has been an invaluable resource of information about how youth and young people are faring in this pandemic and how we can improve access to healthcare in a virtual world. Before I turn it over to our wonderful panel, I wanted to set the stage a bit about the mental health crisis that young adults are facing right now. We've seen rapidly growing rates of anxiety and depression and other mental health issues in young adults over the last decade. According to a study done by the American Psychological Association, between 2008 and 2017, the amount of adults that experience serious psychological distress increased among almost all age groups, with the largest increase being among the younger adults between 18 and 25, an increase of 71% over about that decade. And notably, rates of serious psychological distress increased about 78% among young adults ages 20 and 21 during that time period. Young adults between 18 and 25 report the highest levels of mental health issues compared to all other age groups, with about 1 in 4 experiencing a mental health illness and about 8% reporting a serious mental health illness. Suicide ideation has also increased over that time period as well. Suicide is actually the second leading cause of death among young people under the age of 34. According to CDC data, young people who identify as lesbian, gay, or bi are 4 times more likely to attempt suicide compared to straight young people. And transgender adults are 12 times more likely to attempt suicide compared to the general population. And all of these statistics are before the COVID pandemic hit. The severity of the economic impact, job losses, social isolation, and the fear of the deadly disease itself is causing anxiety and depression to skyrocket among millions of Americans. Many young people are experiencing disruptions in housing, in pursuing their education, in their peer relationships, and have missed key milestones like graduation. These disruptions can be more severe for LGBTQ adults who may be forced to stay in non-affirming households or have lost positive social interactions and access to safe spaces. College students are reporting increased levels of stress, anxiety, and depression, many of whom have had to leave campus, have lost access to campus-based physical and mental health services that they previously relied on. And young people of color have had an especially trying year. Not only have communities of color been disproportionately impacted by COVID, leading to higher rates of hospitalization and death compared to white people. The political environment, the tensions from the 2020 elections, and ongoing racial reckoning has impacted the mental health of young people of color across the board. From the horrific racist attacks we've seen committed against the Asian American community to the deaths of Black Americans at the hands of police like Breonna Taylor and Walter Wallace and George Floyd, among many others. I'm also mindful that the trial of Derek Chauvin, the police officer involved in George Floyd's death, is happening this week, right now. And that in itself impacts our mental health and our ability to engage in conversations like this one. So thank you to everyone who's able to be here today. And while 2020 has exacerbated an already alarming rate of mental health concerns among young people, there's still a lot to be hopeful about. While access to care is still a major issue, telehealth has greatly expanded during the pandemic, especially for mental health services, which has helped to overcome some traditional barriers to care, like transportation issues. Vaccine distribution is creating a light at the end of the tunnel and giving hope that the worst of the pandemic may be over. Schools are working on creating safe pathways to reopening. And more encouraging than anything else, in my opinion, we're seeing younger generations feeling more and more comfortable talking about their mental health openly and positively. And while we must continue to raise awareness and destigmatize mental health care, young people are more likely than older adults to really frame their mental health needs in a positive light. And with that, I'm going to stop talking. I'm excited for our panel to dive into their work, their experiences, and the policies that we can advocate for to increase access, improve quality of care, and ensure that that care is culturally competent and continue to advance young adult mental health. Now, to kick off our panel, I'm very excited to again welcome Isabella, a member of YA's Young Advocate Program in Colorado. Isabella, I know, again, this has been a difficult year to say the least, in particular for young people. As you feel comfortable, would you like to share your story and how you got involved with mental health advocacy with Young Invincibles?
Yeah, so thank you, Erin. So a little bit about my story. My name is Isabella. I'm a first-generation immigrant from Brazil. I moved to the United States when I was 15, like 3 years ago. And I've dealt with mental health issues throughout my whole life, but it got progressively worse when I moved to the new country. It was just me and my mom. She was a whistleblower in Brazil. So when we moved here, there was a few like stressors during the move itself. And with high school and then her getting settled with her visa and everything, it was just very stressful. And yeah, I'm also not the type of person who talks about what I'm going through. I'm not very comfortable opening up. Like now I can talk about that story because I'm not really dealing with it anymore. But when I'm in the moment, I cannot really talk to people. So it was hard getting help outside of just me and my mom, we just kept things very familiar. But so I didn't have healthcare, I didn't have any insurance I don't have it even now, but I didn't have it for like a year. And during that time, the only healthcare I got was from my school clinic. That's how I got my shots and everything, because it was just like free. And the lady in the just the health clinic, she would check up on me, and many times she would just like ask me one question about my family or my mom, and I would just break down crying. So it got to the point where she was kind of worried. And that was my first contact with someone outside of my family to talk about my mental health. And that was also how I could get my Medicaid, and I could get my prescription. I was diagnosed with anxiety, and then now I'm in prescription, and now I'm doing better. So yeah, that was kind of like me finding out my own mental health issues. And from then on, it was a rocky journey. I did have Medicaid through my school, through the Denver Health thing. But when my got married and we started applying for the green card, we couldn't stay on the Medicaid because of the public charge rule. So our lawyer said that it was better if we just canceled our Medicaid. And that was difficult. It was also right about the time where I finished high school. So even the free clinic from school wasn't really available anymore. So it was a lot of like juggling. What is the cheapest doctor I could go to that can keep prescribing my medication? And thankfully, my family had, my stepdad had a family doctor that did agree to keep prescribing. But since I wasn't covered by insurance, I did have to pay like $200 for visits out of my college savings and all that stuff. So it was a lot of like, every time that you need to think about your prescription and getting your refill, it's stress because you're not sure how you're going to get it. And after all of that, I came to YI. I'm not even sure how I got into the Young Advocates program. It was just a whirlwind. I just ended up there. I didn't really know that they had this much mental health focus. And I wasn't even that comfortable talking about my mental health, but it got to a point where a lot of people were talking about it around me, and a lot of people were being vulnerable about their own stories. So it just became easier and easier to think about it and to see the examples inside my own story and how I could apply them to like other people's stories. And now I'm more comfortable and I'm thankful for this journey. But yeah, it was it's a rocky journey. I don't really know how to explain it better, but yeah.
Thank you. Thank you so much for sharing that. I think you illustrated a lot of different factors I think impact our mental health. You mentioned public charge, which was a policy of the previous administration that caused what we kind of call the chilling effect, which a lot of people did disenroll from Medicaid and from CHIP for fear that it would hurt your immigration status. It actually impacted a smaller number of people than people thought that it did, but it caused so much fear. Just so our audience is clear, the current administration has reversed that policy, so that is no longer in effect, and you cannot be negatively impacted when applying for a green card if you take advantage of programs like Medicaid, CHIP, and SNAP. So it's really good and important for folks to go ahead and do that if you need health coverage or food assistance or housing, that none of those things will count against you anymore. But I think, again, the immigration policies, the layoffs because of COVID and, all of those things really can impact our mental health. And, as a student graduating during COVID and then looking to go to college and kind of figuring out what your next steps are, can you talk a little bit about how this past year has impacted, your thoughts on pursuing higher education?
I will say, my first thought when I saw this question was, like, when I finished high school, it was May 2020, and we were really just starting the pandemic. We didn't really know how bad things would get. And it was the best time of my life. Like, it was to the point where I was thinking I could get off my prescription, and I was trying to change the way I was living. And I can say that right now, I don't think I could survive without my prescription. So it's definitely been difficult during the time with the pandemic. I did have to defer from college. So I'm starting at Colorado School Mines in the fall because I couldn't fathom paying that much money and then not having the proper experience, but also just sometimes when you think about studying and you think about everything that you have to do, you get so stressed and it just can feel like things are piling up. And then it might get to a point where you're like, okay, now I need to prioritize myself. But then how do you prioritize yourself and keep with the deadlines and keep everything working? So it got to a point where I was taking a few classes at CCG. And even then, I was like, I needed to do that. I needed to work. And then it got to a point where, I'm not sleeping properly, or I'm not doing this and I'm not doing that. So how can I take care of myself? But to take time to take care of myself, I can't like do my work properly, or I can't really study that much. So it's difficult managing the time when you got all those other stuff and you live in this difficult world. And I'd say, I don't know, I live with my parents right now. So I couldn't like go to campus and all that stuff. But it has been also difficult because we all, during this pandemic, everyone in my household was unemployed. So as soon as the pandemic hit, I was like May, that was the point when everyone was unemployed, and it was like that till December. So it was just the three of us inside the house most of the times. And like I was doing school, and I was like, I had to go to work or do like volunteering and stuff, but it was still just so closed up, and that does kind of like not help with the mental health issues, and not like just a fresh air would help, you know. So yeah, that was kind of an issue too. And to the point, there was always also like I was taking classes, but I never felt like I was actually in a school community. It was more of that feeling of like the same thing as if I were just going to YouTube and looking at a tutorial or something like that, or looking at playlists of classes and stuff like that. I didn't feel connected with the people on my class or my teacher and anything like that. So it was just even harder because it was just basically me in my room and just, you know, thinking about life. And when you have that much time to think and that much time by yourself, it can be alarming. So yeah, I would just say it's been a lot, especially when it's just you by yourself. We talk a lot about like, oh, it's a lot of work in online school, or kids are not getting like the proper help and all that stuff. But there is also, I don't know, just the anxiety of having this set work and knowing that I have to do all this by myself while also like taking care of myself. It's just a lot. So yeah.
Yeah, absolutely. I think that that sense of community and that support is something that I think we felt in a lot of different places where we don't have those kind of physical spaces to gather anymore. Cameron, I'm wondering if you could kind of pick up where Isabella left off. One of the things we talk a lot about is the need for college campuses to invest in real access and resources for students. Can you talk a bit more about your work that you're doing out in Colorado on this issue and others?
Sure, I'll be happy to. First, I just want to thank Isabella for joining us and sharing her story. It's so appreciated. In Colorado, we've partnered with the Department of Higher Education and Institutional Leadership to create a statewide program called the Healthy Minds Checklist. This checklist aims to provide recommendations for inclusive behavioral health programs and enhance existing campus resources. Once an institution implements a certain threshold of programs and meets the checklist requirements, schools will not only provide a wide range of support services for students, but will also earn a designation from the state indicating that they are a Healthy Minds campus. We've already seen lots of innovation in mental health services available at lots of different campuses across the state, including virtual services, free mental health screenings, counseling sessions, easier access to information, and increasing data collection. But what the checklist aims to do is amplify all these existing services and make them accessible to all students across all the institutions in Colorado. The checklist stemmed from recommendations directly made by Colorado students within our programming, which was super exciting. In addition to ensuring that higher education institutions are beginning to implement these different programs and apply for the designation this year, we are also leading on a state bill that would require insurance companies to cover mental health checkups similar to what they do with physical checkups. And then we're also partnering with organizations like the Wellbeing Trust and Active Minds to create a digital tool set available to young adults across the country to provide guidance on how to actually get involved and lead mental health advocacy and policy. In addition to that, throughout any given year, we always help young adults in and out of our programming host what was in-person events, now virtual events, on a variety of different topics surrounding mental health, like just destigmatizing the conversation, providing space, a protected space to talk about mental health among students, and then also just provide additional recommendations from resources given directly provided by providers themselves.
Great, thank you so much. Stacey, I'd love to turn to you now. I mean, I know you have considerable experience working on implementation and dissemination of mental health resources. Can you just tell us a little bit more about your work and what do we need to invest in to meet the needs of young people?
Sure, absolutely. And be speaking mostly from my experience in the context of healthcare settings, and a little bit outside of that. But, I think all of the kinds of things that Cameron was just talking about, I mean, that's so impressive. And that's really the direction that I think that we need to go and what I think the evidence supports. So integrated behavioral health services and mental health and substance use services, both prevention and treatment, also screening for trauma. Some of the kinds of experiences that I think a lot of people have been through, Isabella, that you touched on a little bit. Also having institutions moving toward being able to provide trauma-informed care across the spectrum, and then prevention of adverse childhood experiences. I think it's important to remember, and Erin, you alluded to it a little bit in your introduction, that most young people are really at the peak of their physical health during adolescence and young adulthood. And the top 3 causes of mortality and morbidity in this age group are really closely tied to mental health and substance use. So they're accidents, suicide, and homicide. And so, in focusing on mental health, we'll be improving health and well-being across the board. There's a growing body of evidence that integrated behavioral health services really do improve outcomes across the board. And right now, we've always had a really fragmented system of healthcare, and we have silos, and we have mental health care over here, and addiction treatment over here, and regular physical medicine, over here. And I think that there's a lot of evidence that pulling those all together, normalizing conversations about mental health and about substance use in physical, primary care settings and other healthcare settings really can improve health and well-being. And we need to, invest in training clinicians, starting with medical school and nursing school and schools of social work, obviously, and also teacher training programs and university, training programs, so that these conversations are more comfortable, people are educated in that, and then training people who are already in the field. Under Obamacare, there was a lot of work done to increase the capacity of health.
I think Stacey might have frozen. Cameron and Isabella, can you hear me? Okay, great. Let's give her a second and see if she comes back. Okay, Stacey, I don't know if you can hear us, but we can't hear you anymore. So we'll move on to the next question and hopefully we'll come back to you. So shifting gears a little bit to telehealth, I want to dive a little bit deeper into telehealth services. Isabella, coming back to you, I would love to hear your thoughts on telehealth and how, I think there's this perception that young people are very comfortable with technology, more comfortable with virtual appointments, maybe more comfortable with things like text therapy. So we'd just love to hear your thoughts generally on telehealth services, if you know folks who use telehealth, and any kind of pros and cons that you see to expanding telehealth.
Yeah, I have very mixed feelings about it. Mostly, I think it's just because of my personal preference. I mean, as I said, like it takes a lot for me to tell other people my issues, and then I feel like with telehealth, there's something like a connection that you kind of lose, a bigger connection with the person if you were able to like go to their office and see them and talk to them and always have that person. Because that's also how you get the trust. And I feel like with mental health, tackling so many issues and being so vulnerable, that element of trust is so needed. But I do know that some people that are very like comfortable with it. My mom, she was just getting her refill prescription, and she did during the telehealth call. She loved it, and she was even able to like they let her know that she could get the COVID vaccine. So, and I mean, like even things like that, like she wouldn't be able to go in a normal day, or she would have to go very quickly, like in the middle of her lunch break or something like that. So it's much easier for people who have like busier lives. And I have seen friends of mine that have some of those apps where you can like talk to someone, talk to therapists and all that stuff. I've never tried it, but I do think that there is an element that is like you can get help easily, and whatever is your availability or whatever you're comfortable with. Sometimes even some people are not comfortable like going out and going into a therapist's office or like being seen or talking about like leaving their house and going into a clinic and doing that stuff. So I do really like that accessibility point. Like it's available for everything. I do feel like there is the personal connection, and the trust part is harder to get when you're doing telehealth. But I also don't have a solution for that. But yeah, very mixed feelings. I feel like it's a lot about who you are. But it's definitely something that, because of the accessibility point, I wish there was a lot more of it around. And I wish there was also more information, because some people who have access to it and who would love it also don't know that there's that help for them. So yeah.
Yeah, thank you for that. I mean, I think that you really hit a lot of the main concerns. I think a lot of folks are excited about, the accessibility piece that you mentioned. I mean, it can, instead of taking 2 hours out of your day to travel to an appointment and maybe move things around, to maybe find parking and pay for parking that can be very inconvenient, finding childcare, like all of those things, virtual appointments can make easier. But I think you're right. I think a lot of young people also have concerns over quality of care. Are you going to get the same service that you might get through an in-person appointment and be able to build trust and build that relationship? I know we've talked with other young people too who want to use, the text therapy apps, but they're not covered by insurance. So where are there ways where we can kind of expand access to things like that so that you can actually, get the most out of it, but also afford it? And kind of where can we find those opportunities to blend accessibility and quality and all of that together? Stacey, so glad that you joined us back.
Zoom technology.
Yeah. Getting dropped from a virtual appointment might be one
Right, there we go. I was just demoing.
Exactly.
how it happens. Yeah.
Well, I want to turn it back over to you, because I think you were sharing some really great information about changes under the ACA right before you dropped, and then also would love to hear your thoughts on telehealth from the kind of healthcare provider setting.
Yeah. Well, I just wanted to underscore what Cameron said about parity, mental health parity, and how important that is. And so I think that we really have to support parity legislation. You know, we have been moving forward in a really good way, but I think that there are ways to strengthen the laws that are already in place and policies that health systems have about providing, you know, mental health and addiction treatment at the same level as physical health treatment, and really hold health systems' feet to the fire and make sure that they are actually doing that and not just paying lip service to it. As far as telehealth, I mean, I see it as a huge opportunity. It's not perfect. You do, like Isabella, what you're saying, you know, that sort of personal connection. However, I think that the access, I think we can fine tune it in a way and learn, you know, as we go along. But I have heard from so many patients and providers who were kind of forced to jump into the deep end of the pool. Everybody had been resisting telehealth in behavioral health, and have found that it works. And even in groups, you know, even in therapy groups and, you know, alcohol and drug treatment groups, that they are finding the fellowship and the camaraderie that's an important ingredient in therapy. So, you know, hopefully we can learn, but I think the access thing is really huge.
Absolutely. And thank you for sharing that. Cameron, I'll go to you next, just to kind of close out on telehealth. As Stacey mentioned, the uses of telehealth services really did skyrocket. It seemed to kind of change overnight when the pandemic hit. And I think the data shows that about half of all of those services are for mental health services. So it does seem like it's something that is being used, and has been proven to be pretty effective through 2020. So we're just wondering what you think a bigger role for telehealth can be in the future of mental health care, through your experience in your work.
Yeah, absolutely. Actually, prior to the pandemic hitting, why I was advocating for telehealth counseling to be available as part of different like mental health packages that higher education institutions were offering to their students. I think Isabella and Stacey already hit on it, but we were hearing over and over again, particularly the students we were working with, that telehealth, it was their preferred method at the time because they aren't just full-time students living on campus. Students today look a lot different. They have one or multiple jobs. They're traveling on and off campus. Some of them are taking night courses, and others might just feel a little bit more comfortable at that time meeting sorry, I'm just had a blank in my mind, meeting virtually with their providers. And so at the time when we were providing this recommendation to institutions, this wasn't as much as a priority, I think, as the other recommendations that we were giving on the time. But I wouldn't be surprised if all of our institutions, if not most of them, haven't already implemented or shifted their services to be online and available, at least through a few different of their providers to students. And it's so important that they do so. In Colorado in particular, Mental Health America ranked us 47th overall in the country in prevalence and access to mental health services for our youth and young adults, which unfortunately was indicating that we have a high prevalence of mental health illness and lower rates of access to care. And so we're seeing an increase in suicides and behavioral health issues. It's so important that Colorado increases all different types of access to services right now.
Absolutely, thank you. And kind of building off of that, and Stacey, you mentioned some of this earlier when we were thinking about kind of the mental health workforce. But what we hear a lot from a lot of young people is a desire for and an inability to find mental health providers who share their lived experiences, providers who are people of color, who are part of the LGBTQ community, who are younger. So I'd just love to hear your thoughts. What can we do? How can we achieve a more diverse and a bigger behavioral health workforce?
Yeah, we definitely need to diversify the mental health workforce. I was doing a little research in preparation, and I found some really, kind of alarming figures. So non-Hispanic whites account for 76% of all psychiatrists, 95% of all psychologists, 85% of social workers, 80% of counselors, 92% of marriage and family therapists, and 90% of psychiatric nurses. So, and that clearly does not reflect our population, right? But we also know things that really can help, diversify the workforce. So, there was this recent survey done of mental health professionals from underrepresented groups about what helped get them into the field and what helps with retention. And they talk about mentorship, work environment, educational opportunities focused on promoting engagement, assertive recruitment of students from underrepresented groups. And so I think putting in place measures like that will really, can help to diversify the workforce. Also, personal experience with mental health or substance use disorder, or family members who have a personal experience. And building on those last two things, we really need to do a better job of that in the mental health field. I think the addiction field has done a better job because that sort of peer experience, lived experience has been a big part of addiction treatment, and it really hasn't in mental health. And I think there are signs that we're moving toward that. I know healthcare organizations are slowly starting to build up patient stakeholder councils and bodies to advise on how to make mental health more patient-centered. And hopefully that will also result in people being brought into the field as professionals, being trained and so forth. But I think we really need to do a better job of that. I mean, yeah.
Yeah, absolutely. Okay, I just have a few more questions I want to get to, and then we'll open it up to the audience to hear the audience's questions and comments as well. But I think that's a really good segue actually into this next topic where I wanted to dive a little bit more into stigma, but I think thinking about how, the lack of mental health providers that are available in certain areas, how that can really be such a barrier. It's like the first step is kind of admitting that you want to seek out help. And then when you can't actually find it, that can really hurt your ability to ever seek out care again. So, I mean, Isabella, I'll turn it to you first, but as we know, it's difficult kind of taking that first step, both emotionally and logistically. So I wonder if you could talk a little bit about your thoughts on how do we get past that barrier, and how in your opinion, do you think we can work to eliminate stigma so people feel comfortable reaching out and seeing what sources are available to them?
Yeah, stigma is such a complicated thing. I've been trying to think of like one response, but I'm not completely sure. I would say that the first thing that comes to mind is definitely just talking about it. I think I said it before, but it was only when people kind of told me their stories and kind of were vulnerable around me that I became more confident in telling my story, and also more confident in owning up to my story and my experience with mental health. I feel like we need to talk about it a lot until it becomes like normal to talk about these like realistic experiences, because no one has the perfect life, and also those different experiences, because part of the stories that I've heard are very different from mine, traumas that I couldn't even think about dealing with, and I just think that puts your issues in such a bigger perspective, that I feel like that's a very important piece. I also think like taking the first step, as long as you're comfortable about it. Of course, I wouldn't suggest you if you're not comfortable about it. But like taking the first step. I do remember when I was diagnosed with anxiety, that also like prompted, when we got the Medicaid, also prompted my mom to go to a mental health clinic and to see if she could get medication. and she ended up in the same medication as me. So for like a year, we were taking the same prescription. And I mean, she got off of it a few months ago and she's doing much better now. She's great. But just like it was, I took that first step and then we started talking more about it because we were in such a, I mean, we were in the same situation, just every stress thing we were sharing for 2 years. And I mean, when I took that first step, she kind of came with me. And then that way she got her help, and then her life now it's like changed completely. And I can clearly see that she's much happier. So I feel like even if you don't see someone that like is around you that clearly needs help or that clearly could benefit from like mental health care, I feel like just taking that step and showing that it's okay to seek help or to prove that you're not all put together and that you might need help putting some pieces along. I feel like that's such a great step. And that's just, it's, even if it doesn't like change anything about the people around you, it will make you more comfortable in talking about it. And then when you're more comfortable talking about it, you can spread it farther along. Yeah, and I also wrote it down like the last piece when I think about stigma is only doing what's comfortable for you. Like I did feel like when I was starting my mental health journey, that I had to try a therapist because that's what most people around me told me that it worked for them or that it was like the right thing to go. And I've tried a few of them. And then I just have trust issues and I wasn't really comfortable talking. And it's just, I wasn't comfortable and it had to get to a moment where I had to decide this is not for me, but I'm also not gonna give up on trying to see what can work. So just accepting that you're not gonna be comfortable with the first solution or maybe the second solution or whatever it is, but trying to see if there is a space where you can feel comfortable within your experience and you can feel comfortable with your issues and all the things that you don't love about yourself and all the things that you need help fixing. Just staying true to yourself. I think it's a very important piece.
Absolutely. And thank you so much for sharing all of that. I think that one, I think you talked about how personal stories can really be powerful and they can help relate to others and they can help destigmatize our mental health in so many ways. And I really appreciate you sharing all of your story today with us. I think you're probably inspiring people right now by how open you're being. So thank you again for that. Cameron, I want to shift a little bit to advocacy. We talk about the power of storytelling and how that really can change hearts and minds. So I would love to hear more from you of how do we kind of frame our messaging and our advocacy efforts to, bring partners on board to raise awareness and, move lawmakers to take action.
Yeah, I just think it's so important that we continue to make noise. In the past, I think it was very easy to place the conversations surrounding mental health on the back burner of priorities, both on an institutional level and a personal level. It's one of those things I think individuals do where I'll get to it later, because most of the time they're taking care of others or worrying about other responsibilities. Now I've seen conversations pop up more and more in different outlets as people are experiencing isolation during COVID, unfortunately. But we don't want those conversations to stop. We need to continue to encourage others to share those stories and help them understand the different intersectionalities as well that are being connected between like mental health, race, LGBTQ issues, climate crisis, affordable housing, and so much more. Storytelling really can play such like a huge role in destigmatizing the conversation and feeling comfortable to, one, ask for help, and then two, advocate for more support and resources. We're definitely going to see a very long-lasting impact of how COVID's affected people across the world. And I think we need to be very mindful of how imperative to take actions and create some kind of support system and structural change. And I personally think that we cannot wait to take action, and that we cannot wait for decision makers to take the lead on making that change. We got to push them in the right direction, and it's really important that they hear from all of their constituents, including youth and young adults, and letting them know that this is a very important issue to them. In addition, I think to larger decision makers like elected officials, I think it's really important for us to start exploring different recommendations of solutions in different settings, like resources and supports in a work setting or in different community-based settings. Stuff like ensuring that adults who are working with youth or younger generations maybe are participating in some kind of like evidence-based mental health trainings, so they feel equipped just in case that youth or young adult feels comfortable sharing what's going on, and they could at least point them in the right direction of how to receive help or resources or supports.
Absolutely. A lot of great information in there. And then lastly, I see a bunch of audience questions coming in, so I want to make sure we have time to get to those. But Stacey, I want to come back to you. I know we've talked a lot today about, the critical need to remove stigma and advocate for inclusivity so that we're reaching all young people and meeting them where they are. I know you talked about this a bit already, but I wonder if you could share more about, how do we start to create a more integrated system of services that reaches into settings as varied as, primary care in our schools and our prisons and our workplaces and our homes?
Sure. So, I mean, just a couple of thoughts. There's still a lot of stigma connected to receiving specialty mental health care, right? Or specialty addiction care. There are just, those spaces are stigmatized in a lot of people's minds. And there are a lot of barriers, logistical barriers, the cost, the transportation, cultural and linguistic barriers. So I don't want to minimize the importance of specialty care or perpetuate the stigma. I think that those are really important to strengthen, but I think that we need to broaden where we're offering, mental health services, exactly the kinds of things that Cameron was talking about, and what Isabella referred to when, somebody in her school-based health center was finally the person who asked her how she was doing, opening up that conversation and normalizing those. And that, really requires training people across the board in all these sorts of community settings. I will say, though, that I agree with what you said, Cameron. I feel like we're at a really important inflection point, or a point of opportunity. I've been doing focus groups of families of young people and of pediatricians and adolescent medicine doctors around the country, really diverse, intentionally diverse samples. So urban and rural and conservative and liberal and Black, white, Latino, Asian, groups of people. And to a group, I hear this new openness to talking about mental health, because I think that everybody, because of the pandemic, it's like one of the few good things to come out of this is that everyone is so stressed out. Everyone is so distressed that, parents and people are saying they are so concerned about mental health and about prevention and about moving forward that they are open to having these conversations. And, I've been around long enough. I've never heard an openness like that before on this stigmatized issue. And I feel like it's a wonderful opportunity to increase those messages for the advocacy that you're talking about. I think that we can really make something happen. So.
Yeah, absolutely. Thank you so much for that.
Sure.
Okay, great. So we've got about 10 minutes left. I see that we've got a few questions that have come in already. For other folks, if you would like to ask a question, please do so either through the Q&A or through the chat. Either way is fine. Go ahead and type out a question and we'll get to as many as we can. Our first question here asks, what about young adults who are not enrolled in college? What are the systems that can support them? I don't know if Cameron or Stacey, you want to maybe take that one?
I can jump in real quick and just provide I guess, perspective on behalf of YI. We don't exclusively work with young adults that are just in college. We work with young adults that have already entered the workforce, graduated college, decide to go through a different path. And it's important for us to bring in outside trainers to provide different kinds of supports and resources and information, ranging from trauma-informed care to mental health first aid training, and also just talking about like what services they offer. We have lots of different providers that also shifted their services online, which is really great. And they've started to even expand sometimes their demographics and their reach, their age groups. And so I really just encourage you to reach out to community groups, because a lot of them now are, even if they're not direct service, a lot of the policy and advocacy groups are really tuned in into what different resources are available to whatever demographic they're serving.
Yeah, I would add, there are programs like Youth Build, which focuses on young people, training young people in the trades. And, even they have mental health and substance use prevention and treatment programs. So I think there are a lot, besides outside of the colleges, there are different systems.
Great, thank you. So here's actually, I think, a really great question. Where should we start for somebody who is struggling to maintain positive mental health? Where should they start looking at resources or treatment options? I'll open that up to anybody who wants to answer.
Well, I would say, it depends on their setting and their age. If they're in school, there might be a school-based health center. If they're out of school, they could, depending on where they get their health care, say a federally qualified health center will usually have behavioral health services. If they are in a community college or a four-year college, there's probably a counseling center. There are also a lot of online free resources. So there are warm lines and hotlines, depending on, what it is. There's suicide hotline, there are substance use lines. So there are, the web is an incredible, it can be fraught with a lot of weird stuff too, and it's incredible resources for bringing people together in communities who are dealing with challenges.
Yeah, I think Stacey's completely right. Depending upon what you're looking for, I don't feel afraid to put that into your search bar. I mean, Isabella's helped us here at YI put together specific resources for immigrants and communities and how to access mental health care and support. And so I would recommend just doing a quick search and also utilizing those crisis hotlines, because they're pretty well trained and equipped to provide some next steps. And then if you do have health insurance and coverage, reaching out to them and seeing what's provided.
Great, thank you. How would you recommend getting adolescents in middle and high school to feel empowered to make suggestions and voice their concerns about mental health?
Well, I mean, there are a variety of different ways. Obviously, that they can talk to their peers, talk to teachers or counseling staff. Often schools have site councils. At least in California, each school is required to have a site council, and starting in middle school, there are student representatives. So either joining the site council or finding out which of your peers is part of that and talking with them about the need to, raise mental health awareness. My experience, I mean, it's hard because people are often shy about speaking up, but usually schools are looking for content, looking for participation. So they'd be so happy to have students be interested in raising the awareness.
I would also encourage school leadership to kind of take a part of that and encourage their students to get involved to provide resources or supports on getting that started up, and also doing some research to see what other high school students have been doing across the United States and seeing if that's something you could replicate. And don't feel shy in reaching out to them if you have their contact information, and seeing how you could replicate their practices at your school.
We're starting a chapter of some, there are some national networks of organizations, and, schools can start their own chapters.
Yeah, I just also wanted to add a little bit, I know that as a student, I did feel the most comfortable in talking and suggesting stuff about mental health or just health in general. When my teachers would talk about it or would open up about their own stories. There were a few teachers who had health issues or who had stressful family health issues. And when they would talk about it, it would just be oh yeah, I might not be able to relate, but you're being vulnerable. So I could open up a little bit more. And that makes me feel more empowered in just talking about it and using that voice in that setting. And I would also say, as you talked about student boards or leadership stuff for students, I was in the student board at my school, and something that did help a lot was the teacher would kind of let you she would let us say what are the issues that we see around the school and what are the issues affecting us, and then we would go from there, and it would be a whole thing where we could talk with the administrators, and we could work with the school to maybe create something more concrete or something that would help more students in what we're dealing with. So giving that space where you're not really controlling what the students need to talk about, not saying, oh, you need to do something related to mental health or to healthcare. Just giving that space where students can feel empowered to make some change in the school, and to actually talk with the people that are the administrators and the principal and all that stuff, and to give them a place where they can use that voice and actually make change. I feel like that is something very helpful, not only for the students who are on the student board, but also for the students who are seeing those other students making that change and who might feel more comfortable in their own power. So.
Absolutely. Thank you so much. And I know we're out of time now, but I really love that we're ending on a note of empowerment. So thank you so much for that question and for all of your answers. I apologize if we didn't get to all of your questions or comments, but I want to say again, thank you so much to everyone who's joined us today. Thank you to all of our speakers. Thank you to the Center for Developing Adolescent for partnering with us to put this together. I really, really appreciate all of you taking the time out of your day to join us. We do have resources on our own mental health work, as well as other organizations' resources as well on our website. So please do check that out at younginvincibles.org. Follow us on all the social media. We're on Facebook, Instagram, Twitter. Thank you again for joining us. Please take care of yourselves and the people around you, and I hope to talk to you all again soon. Thank you and have a great evening.
Bye. Thank you.
Thanks. Bye.